much of this issue has to deal with how we are handling our homeless population. We have about 7,000 homeless people in San Francisco. So on any given night, our paramedics are having to work with that population, help them get services. And what we found is that the rate of emergency room visits due to acute or chronic alcohol use is 61% higher in San Francisco than California overall. The San Francisco Fire Department, in fact, launched a paramedicine pilot project last year between February and July to reduce the number of patients transported to emergency rooms with alcohol-related issues. The paramedics were trained in protocols assessing patients, and if patients met certain criteria of excessive alcohol use and had no other acute medical needs, and again, these paramedics were trained to assess the situation and make a determination, they were transported to a sobering center. The sobering center is staffed by nurses and medical assistants, and during the 6-month pilot, 274 patients were taken to this sobering center. Of that, 7 were subsequently transported to the emergency room, and in all, a total of 267 emergency room visits were now avoided. They were taken to a sobering center and didn't waste the time of our critical San Francisco General Hospital. This freed up doctors, nurses, and obviously emergency room personnel to deal with what they're really equipped to deal with, which is very severe traumatic situations.
The ER is being misused, and it's taking the important resources away from other patients, while at the same time not providing appropriate and timely care to those who may have behavioral health issues. We see many patients. I work both in Northern California as well as in Southern California in many different ERs. We have seen many patients, those particular patients needing the specialized care, and their needs are not being met. So it's almost like a vicious cycle that we mentioned earlier too. Unfortunately, by sending them to the ER, we still cannot, provide them the care that they truly need.
Allowing these individuals with alcohol addiction, especially those who may be homeless or suffering from mental health issues, to be treated at sobering centers instead of emergency rooms provides them with more targeted care, but also saves very, very critical county and state dollars. With such success in San Francisco, we were very proud as a city and as a delegation to come out in support of my colleague, Assemblymember Gibson's bill.